Hey guys, I'm back. I'm so sorry. It looks like I actually was on the right page. So we're just going to start this over for anyone who is just joining me right now. Again, I totally apologize. I am back here for the 3-part Facebook Live series on gut health in kids. Please come back and join me if you watched my little snafu where I thought that I was on my personal page. So say hi to me, give me some love. I could use a happy face right now. I want to share with you all this information tonight. So let me know you're here. I know there were some awesome folks here before that I totally, want to share this information with. So again, I am Holistic Mama Doc, Dr. Elisa Song, founder of Healthy Kids, Happy Kids, and your host of the Thriving Child Summit. Thank you for the love, guys. Again, I had a little snafu. I'm back here. Give me a thumbs up. If you could please write down, share with me who you are, if you're a parent, if you're a practitioner. This is all about gut health in kids. Let me know what your questions are on gut health. So we are going to be taking a Hey, Elizabeth from Brooklyn, New York. I was actually born in Brooklyn, so I love New York. I was born and raised in New Jersey, so that's near and dear to my heart. We're just getting started again for the second time. So Robin Matera, you're here. I wasn't sure if I was feeding to the right Facebook page before, but I'm here now on the Healthy Kids, Happy Kids Facebook page. So we are getting started. I had a 3-part Facebook Live series on gut health and kids. We are on part 3 this week. Part 1 was all about the foundations for a healthy gut. How to start off with a healthy gut microbiome. Robin, you're from New Jersey too. And part 2 was on leaky gut and kids. Part 3 today is all about taking a deeper dive into leaky gut and how pediatric functional medicine and healing leaky gut can help your kids thrive. So we are going to get started. Please, again, if you already share this with your friends, please take the time right now. I apologize for the hassle, but post it on your timeline, tag and share with your friends who want to hear about gut health in kids. We're going to start and take a really deep dive. Hey, from Nevada. I love Nevada. I hope you guys are not too cold there. We are really cold here in California, at least from what I consider cold. And Esther's from Sydney. Thank you for joining. And Shay's from California. I actually am right here in the Bay Area in California, just south of San Francisco. So tag your friends, share with your friends, share with any friends, family practitioners who could benefit from really exploring gut health and how it could help their kids. I just want to remind everyone, I have a pinned comment up at the top. This has all the resources for you for today's Facebook Live. I have a free guide for you to download on the 5 R's to healing your child's leaky gut, your free guide to choosing your child's probiotic that we spoke about in part 1, the foundations of a healthy gut. I have a link to sign up for my Healthy Kids, Happy Kids newsletter because I'm definitely planning on doing these Facebook Lives again. They're super fun. I love sharing this information with you. So I want to make sure that you guys are up to date and informed about my latest Facebook Lives and articles on holistic pediatric topics. Also, just so you know, I am in any week now about to release my Everyday Holistic Pediatrics online course to teach parents how to use their natural medicines toolkit, my pediatrician approved natural remedies, including essential oils, homeopathy, acupressure points, herbal medicine, nutrition, and lifestyle to really help manage the most common childhood conditions like ear infections and colds. And we're heading into flu season here in the States, fevers, stomach flus, sore throats, you name it. Shay's from California. Tracy, hey, from London. Wow, Tracy, it must be super late for you. So thank you for joining me here on Facebook Live. Tracy is in London for the year, and hopefully you come back so I can see you in person. So the other thing I want to mention, Summer Bach was on before. I hope you're listening, Summer. Summer is amazing. She is the fermentation and gut health expert. And this week, so I've done for the past 3 weeks a series on gut health in kids because gut health really is a foundation for your child's health. It's a foundation for all of us, right? The health for all of us to help us thrive. And so Summer is hosting the Better Belly Project, which is a free online conference this week. There's 50 gut health experts to really help you take a deeper dive into what I've been talking about for healing children's and adults gut health. It's going on this week, and you may have missed some of the talks. My talk was on Sunday on leaky gut in kids, but there's a replay of every single talk on Saturday. Okay, so be sure to listen. I have the link there on the pinned comment as well. Okay, and then the other thing I want to make sure that you guys know about, make sure that you know that if you're interested in these topics and interested in connecting with more parents worldwide, really, with a community that is dedicated to helping our kids thrive naturally, body, mind, and spirit, the Thriving Child community private Facebook group that I started as part of the Thriving Child Summit is still an active, amazing, incredible community. It's an incredible resource for parents who don't have access to a holistic pediatrician. And I pop in there as often as I can so I can share, as much information as I can with you. And I learn from you guys. I learn from the parents and the practitioners that are there. I would love if you guys are practitioners, listening in, let us know who you are, because, I get questions all the time. Is there anyone near me? Anywhere, I get requests from parents all over the world, about information about integrative and pediatric functional medicine practitioners. So feel free to share your information, on the comments here. I love to, have those resources too and referrals. So again, just as a review, we spoke about the foundations of a healthy gut and starting out life with a healthy gut microbiome. In part 1. Part 2, we spoke about leaky gut in kids. So give me a thumbs up if you guys were able to listen to part 1 and part 2. We're going to do a quick review, but I would love to know, did you guys listen to them? Did you guys share them? I want to share as much information as I could with you guys, but don't worry if you didn't share them, if you didn't listen to them. They're recorded and they're on my Healthy Kids, Happy Kids Facebook page. And this one will be recorded too. So if you have to, get off early and not finish the whole thing, or you just haven't had time to tune in, it's going to be there for you as a reference. Okay, so again, all health starts in the gut. The gut is connected to every single organ system in our body. The gut-brain connection, the gut immune system connection, the gut endocrine connection, the gut metabolism connection, this intimate link between the gut and the rest of our body and our mind and our spirit. And so we have to remember that. And this is why in functional medicine, we start with the gut. Ideally, we would start life with a healthy gut microbiome. We would start life with, mamas before they get pregnant, establishing a healthy gut microbiome for themselves and a healthy vaginal microbiome for themselves. And I had mentioned this before, but, many people don't realize we have a unique microbiome on different parts of our body, right? We know the most about our gut microbiome, but we have a different microbiome on our skin. We have a different microbiome in our vaginal canal. We have a different microbiome in our eyes, right? Our brain has a different microbiome. And as we learn about these intimate connections and how all the microbes kind of in and on us communicate with our cells, we'll realize how interconnected we all are and how we have to really take care. We have to take care of not just, ourselves, but we have to take care of all those bugs that are living on and in us, right? They're all part of us. We are all one big community. And so, nowadays what we see is, with the disruption to our gut and our kids' gut, because of our modern lifestyle, we're seeing, increasing numbers of children with what's called leaky gut. And if you haven't listened to part 2, go ahead and listen whenever you can. But also gut dysbiosis. Over 50% of our kids now have some sort of a chronic illness, right? Which is just not acceptable. And we're seeing kids with, a huge range of chronic illnesses, from eczema to asthma to autoimmune illness to psychiatric illnesses, and at younger and younger ages. If you've heard me speak before on podcasts or different talks, you've heard me, mention that I have had, toddlers diagnosed with ulcerative colitis and Crohn's disease and juvenile rheumatoid arthritis. And, this is just simply unacceptable. And we can really trace back many of those illnesses to the gut and leaky gut and gut dysbiosis, right? Gut dysbiosis basically means an abnormal balance of the bacteria and parasites and yeasts that live in our gut. And so that is at the core of many of these chronic illnesses. And the potential diseases associated with leaky gut I mentioned last week, they include, pretty much anything our kids are going through, right? Eczema and asthma, colic, and reflux, ADD, ADHD, autism, autoimmune illnesses, any mental health issues like anxiety and depression, of which we're facing an epidemic in our kids. Sleep problems, chronic infections like chronic ear infections or chronic throat infections, migraines and headaches. I mean, pretty much anything that you can think about as a chronic illness in our kids is related to their gut. So, give me a thumbs up, give me, a sad face. Let me know how many of you listening have kids with any of these conditions that I mentioned, or know a kid, with any of these conditions that I mentioned, or take care of too many kids in your practice with these conditions that I mentioned, right? I mean, we are just kind of at this point where we really need to wake up to the fact that our kids are in crisis and we need to help them. And we can, right? This is where pediatric functional medicine and understanding how to heal leaky gut absolutely can make such a huge difference. So I want to make sure that you hang tight with me. We're going to go through how we can do that, right? So, how do we get to this point of having a leaky gut and gut dysbiosis? Again, it's really kind of what we're doing, to our bodies, to our kids. It's, many of you have heard of the SAD diet, the standard American diet filled with, artificial colors and flavors and preservatives and too much sugar and too much processed foods. And it's not just a standard American diet anymore. It's kind of a standard world diet, right? And filled with pesticides like Roundup that are directly toxic to our gut lining and directly toxic to our gut microbiome. And then we have the standard American lifestyle, which is also becoming the standard world lifestyle of, too many antibiotics, too much Zantac and reflux medicines, too much stress, too much technology and social media, too little sleep, right? Other toxins like heavy metals and molds, electromagnetic frequencies. All of these are sort of culminating in this epidemic of leaky gut and gut dysbiosis and chronic illness that we're seeing in our kids. So, if you want to learn more about leaky gut and take a deeper dive, go back to part 2, of the 3-part gut health series. I go into a lot more information about how to heal a leaky gut and the way that, the road to the leaky gut. But, as we move forward and realize, okay, so this is going on with my kids, right? I'm now thinking my child probably has a leaky gut. They probably have gut dysbiosis. What do I do, right? Is there anything that can be done? And this is where we have to realize, yes, absolutely. Right? Absolutely. I mean, I wouldn't be here today if there wasn't, right? I don't want to just paint a picture of doom and gloom. I want to give you guys hope that if we can find the right, way and the right path for your child can get so much better and your child can thrive. So we're going to talk today about how pediatric functional medicine and healing leaky gut can really help your kids thrive no matter what's going on with them. So before we begin, I just wanted to, get an idea from you guys. If you could give me a thumbs up or a heart, if you've heard of functional medicine or if you've ever seen a functional medicine practitioner. And as I mentioned before, if you're a practitioner, no matter where in the world you are, and you practice pediatric functional medicine, please feel free to, leave your information in the comments. I absolutely would be thrilled to have you as a resource and a reference. I know that before we cut out, there were several practitioners who were listening, like Madiha Saeed, who is the Holistic Mom, who wrote Holistic Mom MD, who wrote the Holistic RX, which is an awesome integrated medicine resource. We had, I think I saw Tina Moore on, Summer Bach was on, Carl Holzer, who's an amazing functional medicine practitioner who sees adults and kids, Lila Masson, who's in Australia. So, share with us, because we need so many practitioners who are out there who can help guide families, who can help kids along this journey, right, to healing. Because it's not a quick fix, right? It's not like, you take, one pill and you're done. It's really, it's a journey. It's a journey together. And you need to find a practitioner who can partner with you, right? So we're just going to start diving into functional medicine. So again, if you know anyone who could benefit from this information, who you think, should be here listening and asking questions. Be sure to tag them, share it on your timeline. We're gonna take a deep dive right now, and I want everyone who could benefit to really understand. Okay, so functional medicine. What is functional medicine? Functional medicine is one of the foundations of what I practice in my integrated pediatric practice. I do also integrate homeopathy, which is another mainstay. I do acupuncture in the office. I use essential oils and herbal medicine, but functional medicine is the foundation. Functional medicine is truly personalized medicine. Functional medicine is root cause medicine, right? It's getting to the root cause of what's going on with your kids and you, right? I mean, we all have some issues that just aren't right. We shouldn't be exhausted all the time. We shouldn't be crabby all the time, right? And many of us as adults just kind of chalk that up to, well, it's because I have 2 or 3 kids, right? It's because I have a full-time job and I'm juggling, work and life and home. But, we shouldn't be, we should be feeling great, right? So functional medicine identifies and really does detective work to identify the core underlying biochemical imbalances that are going on, and then really tries to reverse those imbalances to heal disease, right? So no matter what's going on. So when a child comes to me in the office, it doesn't matter so much what their diagnosis is. That helps me to understand what might be going on, from a physiologic standpoint, right? But I really care more about doing that detective work, right? Really uncovering what are the root causes, what are the triggers for how your kid got so sick in the first place, right? And then functional medicine also understands that our genetics are not our destiny, right? Our genes are not set in stone, right? They don't dictate what's going to happen to us. They just allow us to understand what some of our risks are, right? So functional medicine understands that our health is the interaction of our genetic predispositions with our environment, right? Everything that goes into our body and our mind and our spirit, right? From the food we eat, to the air we breathe, to the water we drink, to the thoughts that we think, even to the emotions that we have, all of those, right? And of course, all the other toxins that our body is exposed to, all of those interact with our genes to then manifest as signs of being truly well, right? If we're doing all the quote right things, or as signs of symptoms of being unwell, and then showing up as whatever disease it shows up with, right? So I'm going to share with you my diagram, right, of what functional medicine is. Okay, so this right here is what we call the functional medicine tree, and hopefully you can see this right now. Okay, so this is the functional medicine tree. It's a beautiful tree, right? And so if you look here at the top where the leaves are, the leaves are what we do in conventional medicine, right? It's what conventional doctors are trained to do, is to look at our body, kind of pull apart your kid's body or your body into different organ systems, right? If you have a tummy ache, you see the gastroenterologist. If you're having chronic infections, you see the immunologist. If you're having heart problems or high blood pressure, you see the cardiologist. If you're having thyroid issues, you see the endocrinologist. If you have a liver problem or a neurologic problem, you see the neurologist or the hepatologist, right? So conventional medicine looks at the signs and symptoms and then really parses you out into different pieces, right? And doesn't really see the connection between all of those. What functional medicine does beautifully is really take a look down here at the roots, right? The roots are what's coming into your body. All of those that I mentioned, right, that affect our body, mind, and our spirit, what's going in and then interacting with our genetic predispositions, and then either triggering or manifesting as signs of wellness or illness, right? We see these core clinical imbalances, and then when we have these core clinical imbalances, that's when we develop signs and symptoms. Okay, so those signs and symptoms are then what we can see as Okay, I have joint pains. Okay, my child has eczema. Okay, I am not feeling that well. I have brain fog, right? So that is the functional medicine tree, and that's what functional medicine practitioners really try to assess, right? What are the core clinical imbalances going on? Rachel Brenner, you asked, is this tree available on your website? It's from the Institute for Functional Medicine, which is one of the leading organizations to teach practitioners how to practice functional medicine. So it should be there, but I will post it up, link to it on the comments afterwards, okay? And Maria, you wrote here, you keep trying to watch the videos on Facebook and they keep crashing. I'm not sure, it may be an internet connection thing. We are going to be posting these videos on the Healthy Kids, Happy Kids face page, my website, for you so that you can have, and also we're going to try to figure out how to put it on YouTube. Okay, so and so functional medicine starts with identifying these core clinical imbalances, and of course the gut is where we start, right? We start with the gut, and if you start with the gut and heal your child's gut and heal their leaky gut and their gut dysbiosis, you're going to get your child probably maybe 70-75% of the way there, maybe even more, right? And that's where we start with the 5R plan to healing your child's leaky gut. So if you haven't already, make sure that you go ahead and download my free guide to the 5Rs for healing your child's leaky gut. And just as a quick recap, that includes removing anything that's irritating, right? Whether it's food sensitivities or abnormal bugs in your gut or toxins that you're encountering. We want to repair the gut lining with things like fish oils and glutamine and zinc. We want to replace what's missing, like digestive enzyme. We want to re-inoculate the gut with probiotics, right? That's the 4th R. All those good bugs, whether it's with fermented foods or whether it's actual probiotic supplementation. So if you're not sure which probiotic supplement to choose, that's why I wrote a free guide for you guys on helping to figure out how to choose your child's probiotic. And that's also in the pinned comments there for you. And the 5th R, this 5th R, I believe, is really one of the most important pieces of healing a gut, is restoring and balancing the body, mind, spirit connection. So go back to the second video where I posted a list of resources on helping kids overcome anxiety and worries and using mindfulness and meditation. There's some great books and some great apps to use. But not only do we look at the gut, we look at all of these other imbalances too, these core clinical imbalances, and that includes looking at nutritional deficiencies, or what should probably be better called nutritional insufficiencies, because sometimes on your test, let's say a vitamin D level is ordered and your doc says, oh, it's normal. Well, the normal range may be on the lab values between 20 and let's say 100. And if your vitamin D level is 24, well, it might be considered, quote, normal, but I would say that is completely suboptimal, right? So we want to optimize our nutrient levels. We're looking at immune imbalances or chronic inflammation or infection. We're looking at mitochondrial or energy production issues. Now, energy production issues and mitochondrial issues, these are the little powerhouses in our cell. This is especially important for kids with autoimmune illness and kids with neurodevelopmental disorders like autism. If you have a child on the autism spectrum and you're new to functional medicine and new to this biomedical approach, there's so many things that we can do to really help assess that and work with that. And so I actually did a Facebook Live in April all about the functional medicine approach to autism. That is on my Healthy Kids, Happy Kids Facebook page. If you just search the videos, you should be able to see that if you're interested. We also need to look for kids at their hormonal balance and their neurotransmitter balance. Yes, kids can have adrenal fatigue. Yes, they can have thyroid dysfunction and quote, subclinical hypothyroidism. And of course, they can have neurotransmitter imbalances, with serotonin and dopamine, which then lead to these emotional imbalances that we need to look at in functional medicine and restoring, the mind-body-spirit connection. important. And then looking at methylation, defects is also important. Who here has done the 23andMe testing? Just give me a thumbs up if you've done the 23andMe testing, the genetic SNP testing. I do, I have many parents in my practice who have done the 23andMe testing for themselves and for their kids, or are considering it, right? There was a holiday sale. I don't know if it's still going on, but there was a holiday sale. When we take a look, it's very, very kind of sexy now to take a look at our genetic SNP testing, right? These little changes, these tweaks in our genes called single nucleotide polymorphisms, and say, I have a COMT mutation. That's why, my child has a COMT mutation. That's why, they have ADD symptoms and can't focus. Or they have an MTHFR mutation, and that's why they have chronic eczema or they have autism. We can't hang our hat on a single mutation, right? On a single SNP. It's really in the context of our overall health. And I do use this data, but I don't want you to, rely on it solely. We're just at the infancy of understanding how all of these genetic SNPs interact with each other and with our environment. And we just have to remember that our genes, there's a saying that says our genes load the gun, but the environment pulls the trigger, right? Our genes do not set our history and our destiny in stone. It just lets us know our risk factors, and it should give us hope that we can actually do something with lifestyle and nutrition and supplements to positively impact our outcome, right? And influence our genes in a really beneficial way. And this is where, companies like Toolbox Genomics that really help to assess your genetic SNPs and give practical lifestyle and diet and exercise recommendations to optimize your health. That's where we should be going, right? Not getting hung up on each single individual little SNP. But that being said, let's take a deeper dive into how this functional medicine approach and how Healing Gut might help with certain or any childhood condition, right? So, I did have comments last week and the week before about talking about eczema and asthma and talking about colic or infant reflux, and also talking about attention and behavioral issues. So we're going to take a deeper dive again. If you know anyone who has a child with any of these issues, eczema or asthma or attention issues or colic or reflux, tag them right now. We're going to start talking right now, and I want to make sure to answer everyone's questions if you have them, okay? Now, let's talk about eczema and asthma, right? This is eczema, asthma, and allergies. These are a category of illnesses called atopic illnesses, right? And with atopic illnesses, even though these are manifesting on your skin or in your lungs, it's incredibly important to look at the gut, right? So, and oftentimes with eczema, we have kids who are showing up with eczema either, right from when they're born. I have some parents tell me they were born with eczema, or sometimes it's after they start solid foods, or sometimes it may be right after their 2-month vaccines where eczema, patches start to crop up. So eczema typically starts early on in life. It can persist, but sometimes eczema gets better, but then we see this march into asthma, right? Because they're all in that atopic category of illnesses. And then as kids get older, they start developing, seasonal allergies, right? So we start with the gut and we look to see, are there any gut imbalances? And children with eczema and asthma very, very, very often have many food sensitivities. The biggest ones are going to be gluten and dairy, as it is going to be for anyone with a chronic illness, whether you're a child or whether you're an adult. And I often find that with eczema and asthma, corn or citrus seem to be a problem as well. So the what I do want to make sure is that we assess all the different food sensitivities. Go back to part 2 and see about, when I talk about assessing food sensitivity. So Tanya, I see you just said that my leaky gut link is not correct, and I apologize. You're right, it's not correct. So I'm going to see if I can change that, okay, so that you guys can have the correct link, because that link I put in was for the probiotic guide, which I think I did before. And if I can't change it right now, if you go to my last post on the Facebook Live part 2, it's there, okay? And if someone has that link right now, if you could post it for me, that'd be awesome. Okay, so when we talk about eczema and asthma and the food sensitivities, you can really develop a food sensitivity to any food when you have a leaky gut, especially foods that we're eating all the time. But again, the big ones are going to be gluten and dairy, and I often see corn and citrus as big ones for eczema and for asthma. So we start with the gut. We use our 5 R's to heal the leaky gut as much as possible, right? Which means that we're taking out those foods, we're removing, right? We're taking out those foods for usually a minimum of 3 months. We're replacing, with digestive enzymes. We're repairing the gut lining with fish oils and glutamine. We're re-inoculating with probiotics, and probiotics are incredibly important for eczema and asthma. We found particular probiotics, one called Lactobacillus rhamnosus, to be very helpful even for moms who are pregnant and nursing when they have a family history of eczema and asthma. When moms take that, it significantly reduces the risk of eczema and asthma in their children, right? And so we know that these, that's one strain. I don't want your kids just taking one strain in general. There's so many different probiotic strains that really we're finding every day some different benefits. So taking a broad, kind of multi-spectrum probiotic with as many different strains as possible is generally my recommendation. And then of course with eczema and asthma, there's a clear mind-body connection. I have many kids who their eczema instantly flares, like literally in front of your eyes. They'll get itchy patches when they're stressed or upset about something. Or same thing with asthma. For kids who are maybe super excited or really worried about something, they actually can start to have an asthma attack right then and there, right? So, we need to address this mind-body connection. Super important, with books like my favorites, Don Huebner's What to Do When You Worry Too Much, or Outsmarting Worry. Kids can absolutely learn how to use apps like Headspace. My favorite one right now is Insights Timer or the Calm app, because when you're having an eczema flare or an asthma flare, if you have children who have eczema and asthma, it can be so heartbreaking to watch them going through an itching attack is all I can call it, right? When they're just from head to toe in this frenzy of scratching, or they're laboring to breathe, and if we just have them mindfully focus on their breath and relax, it can, not that they won't necessarily need their inhalers, but it can help them so much to recover faster. And so, really focusing on that mind-body connection and that rebalancing for the gut is incredibly important. For eczema and asthma, again, part of the functional medicine workup, we look at nutritional deficiencies and insufficiencies. One of the biggest insufficiencies that kids with eczema and asthma have are essential fatty acids. So the omega-3 essential fatty acids from fish oils, the EPA and the GLA, and also a beneficial omega-6 fatty acid called GLA. We know from the literature that gamma-linolenic acid supplementation can be incredibly beneficial for patients with eczema and asthma. And these are found in things like borage oil, black currant seed oil, or evening primrose oil. But you know what? There are some awesome 369 fish oil blends. When you see a fish oil that says 369, that's what you're getting. You're getting the omega-3s from the fish oils, plus you're getting the omega-6, the GLA. So, just get a combination. Nordic Naturals has one that we use. It's called Complete Omega or Pro EFA that comes in a liquid form, and also a capsule form if your kids can swallow, and also a chewable form for kids who aren't swallowing yet. For eczema in particular, I look for quote toxins or kind of environmental triggers like detergents. There is a mom in Palo Alto who has an amazing website called solveeczema.org, and she's actually has helped a ton of my patients and patients all over the world in recognizing that many kids who have eczema, their skin is very sensitive to detergent. So using real soaps, like true soaps, and go to our website and look up, Bronner's is a true soap. And this is not just for the skin, but it's for laundry and, dishes and, you name it. So using, things like Calben soap flakes, even instead of the 7th generation laundry detergent. For patients with asthma, really important to look at environmental toxins. And by this, I mean environmental allergies. The number of kids who've come in with asthma who haven't been tested for environmental allergies like dust mites or pollens or mold is surprising to me. And, if we get those under control, then the asthma flares can get so much under control. Magdalena Calabrese from New York. You're right. Thank you for your informative lives. What are your thoughts on recurrent strep throat? So, I'll talk about strep throat at the end. If the strep throat, well, is your connection with the gut? Well, yes, because the mouth is actually at the start of your gut. Right? Basically, if you think about it, we're one open tube, and our gut lining from our mouth to our anus, right? Not to sound crass, but the entire tube, that is part of our gut. That is our GI tract. And so if our gut microbiome isn't healthy, then our mouth microbiome, which is actually completely different than our lower gut microbiome, isn't going to be balanced. So working on that, there are actually some probiotics that are specifically for the mouth to help with the mouth microbiome and colonize with healthy strep species to prevent pathogenic strep species from colonizing. So Magdalena, you might want to take a look at that. I'm wondering, I noticed that your name is Magdalena Calabrese. I'm just wondering if you're related to Joette Calabrese, because she's awesome. She's a homeopath in New York, and she was on the Thriving Child Summit. She's an amazing resource for homeopathy. And I see that Anne, you joined me from Vietnam. So I'm so glad you guys are here with me today. If you're still with me, want to keep going with different conditions, give me a thumbs up. I'm about to wrap up with eczema. Then we're going to move on to reflux and colic, because that was another big topic that a lot of people asked about. So with eczema and asthma, again, I have an integrative toolkit that I use. I use not just functional medicine, but I incorporate homeopathy and acupuncture and essential oils. And, you are going to find as parents different modalities that resonate with you, different modalities that work better for your child or that your child is more agreeable to. So exploring these different options. And I just tell you, and share with you what I use in my practice and find to be successful. But it doesn't mean that that's all there is, right? There's so many modalities, like energy medicine, Reiki, Ayurvedic medicine that I don't practice that have, such profound capabilities to heal, right? So I'm going to speak from my experience and from my knowledge. So with our integrated medicines toolkit, for instance, essential oils. Essential oils are such an amazing adjunct for kids because they're so easy to use, and they have such great therapeutic properties, right? They don't just smell good. And this is where having some knowledge, right, about the different therapeutic benefits of each oil. But for instance, with eczema, using lavender for the inflammation and the itching can be incredibly helpful. And tea tree oil. So tea tree oil is a great antimicrobial, and many kids with eczema are infected, super infected. They have staph, they're colonized with staph, which is why when they scratch, they can easily get staph infections, right? So making sure, you can use a tea tree oil soap or just put maybe a drop in the bath, right? You want to be careful about using essential oils in very young babies. I mean, I do use them in babies, but there's some like the really strong ones, like the minty ones, eucalyptus and peppermint, that you just want to be careful with, right? But I do use oils even in young children. And for asthma, one of the essential oils that is awesome, especially when you're having a lot of mucus and wheezing, is thyme. Thyme essential oil, and any of these essential oils you can use on acupressure points, right? If you're having an asthma attack, using really or eczema flare, right? When you want to get something out of the body, the most common point to use is called large intestine 11, and that's literally at the crook of your elbow. You bend your elbow, and at the crease of your elbow, outer edge of your crease, that's large intestine 11, right? And you just want to just massage. You can, press firmly. You can rub the essential oil right into that point, right? Now, some of the essential oils like thyme, you want to dilute in a carrier oil. And in fact, I just would dilute them because if you dilute them, you won't have to worry about the ones that can be more irritating to the skin, like thyme. Okay, and so now let's move on to colic and infant reflux. If you have any questions on eczema and asthma, that was kind of in a nutshell how I might approach a child who comes to me with eczema and asthma. But colic and reflux, right? There's so many babies who are, diagnosed with reflux, so many babies being put on Zantac or another antacid medicine. And there was a time in my career where I just, I came back from traveling, for a year before starting my holistic pediatric practice, and all of a sudden Zantac was approved for use in babies. This was back in 2005, and I never ever put a baby or a child on Zantac for colic or reflux as an infant. And now, since it was approved, it seems like we're having so many more children placed on Zantac. And the unfortunate thing is, and some babies will need it, but unfortunately, when you use Zantac, it's going to alter, of course, the pH of your stomach and the pH of your intestinal lining, and it's going to change which bacteria want to live there, right? Because we all live in a certain comfortable pH range. Same thing with the bacteria. So it's going to promote just directly this gut dysbiosis, which then is going to promote creating a leaky gut. And so we do see that babies with Zantac, and even moms who are taking Zantac during the pregnancies, there is a higher risk in infants and babies with atopic illnesses like eczema and asthma. This is not to say, if you put your baby on Zantac, and you didn't know better, right? You were doing what the doctor said. Do not beat yourself up over it, right? We don't feel guilty about what's happened in the past, but we move forward, and we move forward with hope, because now we know with functional medicine and integrative medicine, we actually can make a difference, right? Tanya Benton just put up the link to the free guide, the free leaky gut guide. So thank you, Tanya, for that. And I will, after the show, correct that information on the comments. So with colic and reflux, there's so much we can do. And this is where, I'll just tell a little story about, my baby sister, who is not a baby. She has twin girls of her own. These beautiful twin baby girls who were born in April. And one of them was just having severe reflux. I mean, this was just, as a pediatrician, I see so many kids with reflux and colic. And for sure, her baby's was one of the more severe. So I actually flew out in May to help her. She lives in Denver, and help her baby. And this is what we did. And now her baby, her gut is awesome, right? And she didn't need to put her baby on Zantac, and her baby is now thriving and actually, gaining weight beautifully. They both the girls are, and I'm so excited to see them in December. I get to see them and squeeze them in person over the holidays. So with colic and reflux, we know that babies who are more colicky do have more inflammation in their gut. We can measure these levels of an inflammatory marker called calprotectin, and we find that babies do have higher levels. So an anti-inflammatory like fish oils are really helpful for infants who are having these problems. So I had my sister put some infant DHA drops, right, infant fish oil drops, right into their bottles. And we know that babies with colic and reflux tend to have more gut dysbiosis. So there is a particular probiotic that was studied to have very good benefits on reducing colic and reflux symptoms. And that probiotic is called Lactobacillus reuteri. Now, again, as I mentioned before, I don't just put babies on one probiotic, but we added this reuteri species to the Claire Therabiotic infant probiotic that I already had her giving to her babies. And so you can find these commercially. There's one called BioGaia infant drops. That's BioGaia, BioGaia infant drops, and another one called Gerber Soothe infant drops. And I actually, they're the very same. Gerber has bought, the BioGaia probiotic, the reuteri probiotic from BioGaia, and markets it under their own name, but it's actually the very same. So I have no problem with using that one. And then looking at food sensitivities. Now, babies are already born with a leaky gut, right? That's why we recommend waiting till they're, at least maybe 6 months of age to start solids until their gut is more healed up and the leaks are kind of sealed. But, in that stage, when they're having all of these intestinal problems as infants, many of them have, a worsening of their intestinal permeability, a worsening of their leakiness. And they're often responding to mom's diet, right? And the foods that they're getting. What are babies getting, right? When they're born, they're either getting mama's breast milk or formula or a combination, right? And so if they're responding to something in mama's milk, it's typically also because moms have a leaky gut as well and are passing some of these sensitivities on through the breast milk. So, I always work also with the mamas too. So what I had my sister do is take out all the gluten, dairy, soy, eggs, nuts, and chocolate from her diet. So now you're thinking, or, and also anything, if you are a mama or you're going through this, anything you're suspicious of, if you, every time you eat, refried beans, right? Your child is acting up and getting really fussy, then you take that, right? Take that out. Now you're thinking, okay, how do I feed myself, right? If I'm a hungry mama who's nursing, I know I was starving when I was nursing both my kids. We want to focus on everything that you can eat, and there's so much you can eat, right? Focus on the healthy fats, the lean meats and proteins, and all the fruits and vegetables that you can eat, right? There's so much, so we want to focus on what you can eat and not what you can't eat, right? And take those out for at least a couple of weeks. And if you're supplementing with formula, it's probably going to be, the dairy formula, unfortunately, is a big culprit in all of this. Many kids have cow's milk intolerance. So what I do is really recommend, if you're going to use formula, if you have to supplement, or for whatever reason you can't nurse, that's okay. That happens to some of us, right? So, there are some formulas in Europe that I think are much higher quality, much cleaner ingredients than we have here in the States. The HIP organic formula in Europe is dairy-based. It is a cow's milk formula, but just seems to be better tolerated by babies. And then there's an organic goat-based milk formula called Holly, Holle. And those are available here in the States, right? So looking at those food sensitivities and removing those from mama's diet, removing those from baby's diet, doesn't mean that it's going to be forever, right? My sister now is back on eggs, no problem, right? And it doesn't mean that all of them are the culprits, right? After 2 weeks of removing those from your diet, if you're a nursing mama, then, and hopefully by then, babies are feeling much better, their reflux and their colicky symptoms are improved. You can slowly try back those foods one at a time to see how your baby reacts, right? And then, of course, I use my integrative medicines toolkit. So essential oils like chamomile are really soothing. Chamomile is such a gentle essential oil, even for infants. Mamas can drink chamomile tea to have it pass through the breast milk. You can even give chamomile tea to your child, just a little bit. There was a study that looked at an herbal tea given to infants with colic and reflux that was a combination of chamomile and fenugreek, and I believe lemon balm. But for babies, there's gripe water. Gripe water is awesome. It has some chamomile in it and some fennel in it right there. That's easy to give. Homeopathically, I had my sister give the babies these little homeopathic drops for intestinal distress called Cosintol by Boiron. Easy to give. You just squirt the little water packets into their mouth. And acupuncture and acupressure. I did do acupuncture for my little nieces. But if you don't have an acupuncturist who's comfortable, working with infants that young, don't worry, you can do the acupressure points. And what I did were really just 2 points, right? The 2 points that I used were stomach 36 and CV12. And I'm grabbing here on my desk. I have my little baby that I used to teach infant massage to parents. So I have my little baby doll that I can show you where these points are, because it's a lot easier to show on a little model. Okay, so here's my little baby. So CV12, right, is the point if you find your baby's the end of her rib cage, right, and her belly button. Okay, and then you go to the point halfway between her belly button and the end of her rib cage. That is CV12 right there. Again, just gentle, firm massage. You can even use a little chamomile essential oil right there, right? That's an amazing point for any digestive issues. And then the other point to use is called stomach 36. And you could look on WikiHow and get this point. But stomach 36, if you go right to your baby's little kneecap, okay, and then you go to the outer edge just underneath that kneecap, that's stomach 36. This is an amazing point for immune boosting, for digestive issues, for getting into that sort of rest and digest state, right? So stomach 36 and then CV12. And I did acupuncture. I did bring my needles and acupuncture needles and do acupuncture with the babies. And I mean, it was amazing, right? Like literally sometimes while I was doing the acupuncture session, or, immediately after, they would pass this huge amount of gas and this, big poop and be so much more comfortable, right? So these are all some of the integrative tools that you can use. And you don't have to use acupuncture. You can use acupressure, okay? All right, everyone still with me? Give me a thumbs up if you're still with me. I know we've been going through a lot right now. So as a recap, let's see, we just reviewed the 5R plan to healing your leaky gut, which includes removing anything that's irritating to the gut, replacing what's missing like digestive enzymes, repairing the leaky gut, healing and sealing the leaks with things like glutamine and fish oils and zinc, re-inoculating, getting back in all of those awesome gut bugs with fermented foods and probiotics. And finally, restoring and rebalancing the body, mind, spirit connection with meditation and mindfulness and stress reduction and sleep and exercise and all of the things that really are equally important to any of the supplements you may take and to any of the dietary changes you may take. Because if we go through this 5R program and heal your child's gut and your kid's doing so much better, if we don't deal with that 5th R, right, that rebalancing, restoring, they're going to slowly head back to where they were, right? It's that restoring and rebalancing piece that keeps us thriving, right? And this is something we as mamas and papas and practitioners, we need to live this ourselves, right? And practice self-care and practice stress reduction. It's not a luxury, right? This is something that we must do, and it's something that needs to be as much of a prescription as any supplement you're taking. All right, if you're still with me, give me some love, give me a thumbs up. We're gonna move on now to attention and behavior problems, okay? So with attention and behavior problems, focus problems, whether your child's ADD or ADHD or sensory issues or anxiety or, just different outbursts in class, working with the gut can do so much. So this is where if you have a family member or a friend or a practitioner who's interested, tag them right now, because this is so important. I go to my daughters and my son's classrooms. They're only in 2nd grade and 1st grade, and the number of kids that I see who are just struggling, they're struggling to sit still, they're struggling to be in their bodies, they're struggling to be to be in the room with other kids, and it's heartbreaking. I think that it's absolutely worsened since when I was a child, and it's not that more kids are incorrectly being identified or the ADHD is being overdiagnosed or that autism has a broader diagnosis. I think that and that we're just coddling our kids and they have anxiety. I think that really and truly these are stemming from our lifestyle and stemming from gut imbalance and dysbiosis. And so, when we talk about the gut-brain connection, there is such an intimate connection there. The gut microbiome directly affects our mood, our attention and focus, our temperament, and our cognitive abilities. In fact, there's an incredible study that I just read. It's a pretty recent study that looked at probiotic supplementation given to children when they were infants. I mean, I'm talking like under a year of age, like up to 6 months of age. And then they tracked and traced, followed these kids up through the time they were 13 years of age. And probiotic supplementation as an infant significantly reduced, almost to nothing, the risk and the rates of Asperger's and ADHD in the group that was given probiotics, not in the group that was given the placebo. I mean, it's fascinating. And then there's another study looking at probiotic supplementation at 1 year of age, and then they looked at temperament scores and cognitive scores in kids who were 2 years of age, and found that the babies who were given probiotics at 1 year of age had more higher scores on positive affect and social scores in their temperament, and higher cognitive scores. Now, this is absolutely not to say that if you didn't give your child probiotics that they're not gonna have a healthy temperament and healthy cognitive scores. This is just a study showing that how much probiotics can potentially make an impact, right? So we need to look at gut dysbiosis when you have anything to do with the nervous system. Even if your child has zero apparent gut symptoms, if they don't have diarrhea or constipation or tummy aches, it doesn't matter, right? Doesn't matter. You need to look at their gut. So I've kids and parents coming in, and I'll do something called a comprehensive stool analysis, and they think I'm crazy. They're like, why am I doing a poop test, right? My poop is not a problem, right? But we need to, because if we don't look to see what's in your gut, we're not going to know what to treat, right? We can presumptively, we can give probiotics, but sometimes there are things that we do need to get rid of, like parasites or maybe some yeast overgrowth or maybe some abnormal bacteria. There are certain bacteria that we know are linked with a higher risk of autoimmune illness, particular species of Klebsiella or Citrobacter. And so if you have these and there is a family history of autoimmunity, I just like to clear those out. They're not doing any good. They may not be doing any direct harm right now, but they could be setting the stage later for your child. So, these are things we're not going to know without doing a specialized stool analysis, unfortunately. The stool analysis that you do at Quest or a hospital lab is, they're just looking at overall, like, is there any really big amounts of bad stuff like the bad E. coli or salmonella or shigella, but it's not looking at the balance of, the trillions and trillions of bacteria and organisms that live in community in our gut. So absolutely, try to find a functional medicine practitioner to work with you on this. There are more and more functional medicine practitioners that are doing online work. Unfortunately, I don't do virtual work with patients, but that's a possibility. And again, if you're a practitioner listening and you see kids, in your office for, functional medicine and integrative pediatric work, or you do any online work, share it with us. I would love to know. I do get these questions, and, for referrals, very, very frequently, almost every day, asking, do you know someone near me, who could help me with this work? So I'm just here trying to spread the information and the knowledge, because I think not enough parents and practitioners really are aware of how much we can do to help our kids thrive if we take this sort of integrative root cause functional medicine approach. And then we just need to have more practitioners, right, to work with our kiddos. So, and I do want to say, it was incredible. I was at the Institute for Functional Medicine pediatric module training just a couple of weeks ago, and so many practitioners who understand the importance of working with our kids. Our kids are our future. We want them to be our future. We want our future as a society to be thriving. And so there were so many practitioners there who are dedicating their time and, and their money and away from their families to really learn about this. So it's a movement that's here to stay, and it's growing. So I love that. So we start with the gut in our kids, with attention and behavioral and mood issues, and we look at food sensitivities. Now, I said before, when we look at eczema and asthma and colic and reflux, gluten and dairy are, big problems and have to be eliminated in virtually all, cases of kids with chronic illness. I would say that for kids, especially with attention and behavioral issues or on the spectrum, absolute must. Why is that? It's not always just for the leaky gut part and the food sensitivity part. It's because for some kids with neurodevelopmental and neuropsychiatric issues, gluten and dairy will get converted into these opioid-like compounds called gliadomorphins and casomorphins that literally are like drugs in their brain, give them brain fog, goofiness, thinking problems, processing problems, right? So absolutely a must to at least try it, right? And then there are other foods you want to, do your food sensitivity testing or elimination diet. Go back to part 2 of my Facebook Live series where I went over what an elimination diet would look like. And guys, if you want any of me to just write, I'm going to post these videos up on the Healthy Kids, Happy Kids website. But if you want me to, chunk any of them into blog posts and articles, let me know. Put it in the comments. I'd love to hear, what you want to hear more of. I love doing Facebook Lives. I know that some people also like to read in print as well. But what are the other things that we need to think about besides some of the foods that we may be sensitive to? It's also sort of what's in our food or what's on our food. It's artificial flavors and dyes and preservatives that can be like poison to our kids with attention problems. In fact, it's such a shame that here in the States, we don't have nearly the controls and the standards for our food. And which should be the highest priority, right? The food that we put into our bodies and into our kids' bodies. But the food industry doesn't have the same priority. And in the European Union, any food that has a artificial dyes or preservatives in it has to have a warning label that that food may cause attention and behavioral problems in your kid. I mean, right? I mean, we should have that warning here in the States, right? But at least any parent who's having struggles with, behavioral issues or having struggles, with their child with attention problems, they need to know that, right? Because if you know that this child might be poisoning your kid's brain, you're not going to give it to them, right? But you need to know that first, right? And there is, a plethora of evidence and data to support that. There's also naturally occurring compounds called salicylates and phenols in certain foods that Dr. Feingold, he was an allergist here actually in San Francisco in the 70s, I found that these particular compounds did affect some kids with attention problems. Unfortunately, some of these foods are some of our healthiest foods, like the really colorful, berries and red apples. But you can look up salicylates and phenols online and see, maybe there's no test for this. You just have to take it out from your kid's diet, go on a low phenol diet for a couple of weeks and just see. Usually, if that's an issue for your child, within a couple of days, you might notice, oh my gosh, wow, they're like so much more with it and they're paying attention and so much easier to kind of stay on task, right? And then other foods that sometimes I'll see as bigger issues. I mean, sugar, refined sugar, of course. Soy and corn, corn is such a big issue, especially since it's so genetically modified. So those are some of the food sensitivities, and looking at nutritional insufficiencies, right? Those are really important for our kids with attention problems and behavior problems and mood problems. In particular, the ones that I look at are vitamin D levels, magnesium, zinc, iron. Those often need to be supplemented in our kids, especially since many of our kids who have attention and behavioral issues, they also have sensory issues. So they don't have necessarily the widest palette of food. And in fact, if they're zinc deficient, that's going to contribute and aggravate their sensory issues and make them even pickier, right? So there was so Robin Matera asked, your question was, at what age would it be okay to do blood work on a child? It really depends. Unfortunately, of course, this makes sense. The younger your child and the smaller they are, the less blood we can actually draw at one time. But with some of these things like zinc or magnesium or vitamin D, it can be shocking how much kids need to actually get to kind of normal levels. So, I do like to test if possible. Another big insufficiency are the omega-3 essential fatty acids, in particular DHA, the docosahexaenoic acid, which has been shown when supplementing babies with the DHA from fish oil that it improves eyesight and IQ in our babies. But really important for our kids, with attention problems and behavioral problems. And unfortunately, the little gummies, the Nordic gummy worms or the little gummy fish, that's kind of like a treat. I wouldn't even count that as really therapeutic. You really need to get more of that than more DHA and EPA, the omega-3 essential fatty acids, into your kids to really support their brain. But you know what? It's a start, right? You start there. One of the things that I'll do also in one of my blog posts for the Healthy Kids, Happy Kids website is I'll write a compilation of some of my favorite fish oils. Amanda wrote, what zinc supplement do you recommend and what amount? I really can't say the amount because it really depends on your child and their weight. But a good tasting zinc is one by Pure Encapsulations. It's a liquid zinc because zinc can sometimes hurt the tummy and be kind of metallic tasting. So other things, when we look at our kids with attention problems and behavior problems, of course, we're going to look at neurotransmitter imbalances, right? In particular, dopamine and serotonin. Now, there's an intimate link between all of our neurotransmitters, right? Our brain chemicals. And so you can't just look at one in isolation. Dopamine is a main neurotransmitter associated with attention problems, motivation problems, focus problems, addiction problems. And in our kids with ADHD and ADD, that can be, of course, is one of the primary neurotransmitters that is involved. But serotonin has an intimate link with dopamine. And serotonin is our feel-good hormone, relax, help us sleep, help us manage stress more readily. And of course, we know that kids with ADHD often have associated what's called comorbid anxiety, right, and depression. So using amino acids like tyrosine and 5-HTP to support a healthy neurotransmitter balance can make a huge difference. I know Trudy Scott have been listening. She's the food and mood gal, anxiety expert, and she uses it, and that's her expertise, is using amino acid supplementation for mood issues. Methylation issues, right? So methylation issues. Remember I said don't hang your hat on one SNP, this MTHFR, but if you have a really strong family history of neurodevelopmental issues, psychiatric issues, autoimmune issues, immune issues, early heart disease, we know that very likely there are methylation issues in your family and your child likely has them. And so supplementing with things like methyl B12 and methylfolate can be helpful. But again, I really would like you to hopefully be able to work with a functional medicine practitioner, because some kids, the dosage is going to be dependent on what's going on with your kid. And I mentioned also just before, that kids are with ADHD and of course behavioral issues, and if they have outright anxiety and depression, this anxiety piece, this fight or flight state that they're in, is such a huge component for many of our kids. And so then they can't get into that rest and digest and support their gut states. So as much as we can, using those mind-body tools, right? I mentioned Don Huebner's books, What to Do When You Worry Too Much and Outsmarting Worry, meditation apps like Calm and Insight Timer and Headspace. There is a program called Heart Math. It's a heart rate variability program that kids can easily do on their phones. There's a little ear clip that assesses your heart rate variability that you can plug in. It's called the Inner Peace app. And kids and adults, you just breathe in and out slowly, in time with, this pulsing flower, or you can change the image. And when you get into that state of coherence or that calm, alert state where you're in the quote zone, right? We've all been there, right? You're in the zone, you're productive, you're calm, you're alert, you're focused. That's a state of coherence, and we can actually train ourselves to do that with our breath, right? And so for kids, when they're getting anxious about tests or performance, or because so much is going around them in the classroom and they can't focus, using Heart Math to teach kids how to get into that state can be incredibly helpful. I mean, I have a Heart Math. I wish I brought it to show you, but I have that probe, in my purse with me that, it enhances well-being and productivity and creativity. And then we can't forget, again, it's not just about supplements and it's not just about changing your diet. We need to incorporate all of the tools that we know from like a behavioral technique that are really important, like executive functioning, skills, super important for our kids with attention and focus issues. And I'm just going to name quickly 2 books that I think are awesome resources that are must-reads for parents who are going through this and kids who are going through this. There's a book by Joyce Cooper Kahn. It's called Late, Lost, and Unprepared. It's a parent's guide for kids who have executive functioning issues to help parents understand what's going on in their kid's brain and how do they help give their kids systems to organize and manage better. And then for kids, there's a book by Samantha Moss called Where's My Stuff, right? So it's a great book for kids to realize, what? This book was written for kids just like me, right? I'm not alone. Other kids struggle with this. That's why a book is written, and it can give them some really great tools. And I wouldn't want to leave this discussion on attention issues. We spoke about the functional medicine approach, but really without looking at some of the integrative tools, because of course that's what I do, as a holistic pediatrician. Acupuncture and acupressure, so incredibly helpful for anxiety and attention problems. There's one point called the Shen Men point. That's the spirit gate, right? It just helps balance the spirit and calm. And you can find it in the ear. There's also, on your wrist. But the ear Shen Men point, what I'll do often when kids come into the office, I'll put a little seed. It's called a vicarious seed with some tape right on their Shen Men ear point on both of them, and then just have them massage that point with the seed on when they're getting stressed or needing a little bit of extra help. So that's an incredible, tool that you can use. You can look up the ear Shen Men point. That's ShenMen. Essential oils like lavender is really calming. Wild orange is uplifting, and sort of brings joy. Peppermint and rosemary invigorate the mind and help with focus and attention. For your older kids, you could just put these in a little roller ball and they could literally just roll it, on their neck. Or, I just love putting them right in my hands, and I just take a big inhale, when I need to, get some relaxation. Or I have peppermint at my desk all the time, right? That kind of mid-afternoon lull after lunch, I'll just kind of put the oils together and kind of slowly inhale. And I want to mention that, Marisa Snyder, she wrote, and it's called The Mom's Guide to Essential Oils. And it's a really great resource, if you're wanting to learn how to start using essential oils in your home, and all the safety considerations and the therapeutic considerations. Homeopathy, I love homeopathy, right? And homeopathy can absolutely be effective. There's one homeopathic medicine, and homeopathy, is so safe to try on your kids. And even if you or your kid want to go out and try this tomorrow, it should be totally fine. Again, I always say, work with your pediatrician or your practitioner just to make absolutely sure. But the homeopathic medicine that comes to mind when you have a child or an adult whose mind is racing and has 1,000 things on their plate, and they're just going from one thing to another, or can't sleep because they're so excited and so much on their mind, is Coffea cruda, right? What's Coffea cruda? What does that sound like to you? It's coffee, right? But it's a homeopathically diluted coffee, which can help with that state that you get into when you've had too much coffee, right? We know that state. You're jittery, you're talking a mile a minute, you're jumping from thing to thing. It's hard to settle down. And that's often what kids feel like, when they have ADD, right? And herbs, right? There's some amazing herbs like green tea, right? Green tea, so decaffeinated green tea, it has an amino acid called theanine, which gives green tea that helps get you into that calm, alert state. In fact, theanine can be used as an amino acid, a spray or a tablet, help with calming and help with kind of brainwave activity. And then teas like lemon balm or catnip. Catnip is a great tea. It's in the lemongrass peppermint family, but they're very calming herbs, not sedating, will actually help, kids get into that calm alert state that we want. Okay. So that is, that's kind of, my basic approach to ADD and ADHD. Again, when I talk about all these conditions in a functional integrative pediatric approach, it has to be individualized, but this just gives you some ideas of what the potentials are, right? There's so much potential no matter what's going on with your kids. And, Robin asked, what brand of oils do I like? There's so many great ones out there. I am not, wedded to any particular essential oil company. I do really love the Elizabeth Van Buren line because they're right in my neck of the woods here in California, and really high quality. But the doTERRA line and the Young Living, and one of my friends, Jody Cohen, has an amazing line called Vibrant Blue Oils. So some really great lines out there. So again, if you have any questions or want me to write blog posts and kind of delve in a little bit further on different conditions and how you might take a pediatric functional medicine approach or an integrative pediatric approach to different conditions, write me a comment right here on the Facebook Live, because I read those, right? And I go back to those, and I want to share information that's going to be helpful for you and for your children, right? And so now you're thinking, okay, what did we do? Let's do a little recap. If you're still with me, I see that many of you are still with me. Give me a thumbs up. Let me know you're still here. Let me know you're still interested in all of this. I'm so grateful for all of you guys who have kind of hung in there with me and are still here with me, at this late hour in different parts of the world, right? Or maybe morning if you're in Australia. So we went through, we just a little recap of how the gut and the healthy gut microbiome really sets a foundation for a healthy brain and immune system and hormonal system. It's that kind of gut brain, gut immune, gut endocrine connection, right? And also really, then how our gut can get dysregulated with our modern lifestyle, the standard American diet and the standard American lifestyle, to then progress into leaky gut and gut dysbiosis and all of the chronic conditions that our kids can continue to have as a result of this imbalanced gut. And then we did a recap of the 5R program, right? That, hopefully you've had a chance to download my guide to the 5Rs to healing your child's leaky gut. And just did a really quick overview of the possibilities of taking that functional medicine root cause personalized approach to looking at the core clinical imbalances underlying whatever's going on with your child, and then apply that to things like, infant reflux and colic, eczema and asthma, and attention and behavioral problems or anxiety. Now, now you can see the application to anything that's going on with your kids, whether it's autoimmune illness or recurrent ear infections or constipation, whatever it might be. There was a question I saw about, constipation, and I did write a whole blog post. It was one of my first blog posts on how to manage constipation from a functional medicine standpoint. So please do take a look at the Healthy Kids, Happy Kids website from there. And I'm just going to see, are there any questions right now? Let's see. Lindsay writes a recurrent perioral circumoral rash in a toddler. Even the stool testing doesn't point to SIBO. I will say SIBO, small intestinal bacterial overgrowth, is an increasingly recognized problem, really hard to diagnose, really hard to detect, especially in kids, because the best way to test for it is through a breath test. And so challenging for a child to do a breath test correctly. So, if you're thinking about SIBO, then finding a practitioner who can help treat that, because it can be so tricky to treat, can be really helpful. But when I think of rashes anywhere, whether it's itchy rashes or rashes just from the mouth or hives or, just splotches here and there, I always think about food sensitivities. So exploring, are there some foods that, could even be seemingly super healthy for us, but maybe just eating a little bit too much of. Sometimes it could be, there are many kids with chronic illnesses and adults with chronic illnesses who have histamine issues. And histamine issues, one of my friends, Yasmina Ekelenstam, her website is healinghistamine.com, and she's actually, I think today, talking on Summer Box Better Belly Project, and is an amazing resource to understand, could histamines be a problem for your child? And then Dana writes, extreme picky eating with sensory processing issues. Again, if you were able to catch the part where I went through a functional medicine approach to attention and behavioral issues, that all is going to apply. And then zinc is also, one of the things that would be relevant as well. So I see, questions coming in about intestinal worms and, parasite testing and treatment is a huge topic. I for sure will write a blog post on that. But one of the experts on parasites is Evan Brands, who was on my Thriving Child Summit last year. So if you haven't had a chance to listen to some of the interviews, I am going to be hosting another Thriving Child Summit this fall with tons of different experts. In 2016, we had, I think, 36 pediatric, integrative, and functional medicine experts. And last year, I think it was close to 40. So it's going to be awesome. So next steps for you guys. What are your next steps? If you're listening in, you have a child with a chronic illness, you're not sure what to do. Hopefully you can find a functional medicine practitioner. So one of the ways you can do that, if you go to the Institute for Functional Medicine's website, remember that functional medicine tree that I posted up? That's from the Institute for Functional Medicine's website. If you didn't see that tree, if you caught this late, go back to, once this is up and recorded on my Facebook page, look at that functional medicine tree. It's beautiful. It gives you a snapshot of what functional medicine is, looking at the root causes. But go to their website, ifm.org, and they have a practitioner database. I mentioned that we just had a pediatric module where I know some of the practitioners like Carl Holzer, who's been listening, were at. And so you can actually look to see who's taken the pediatric module to know who's maybe had a little more in-depth training in pediatrics. And then, next steps, hopefully, if you haven't already, please do sign up for my Healthy Kids, Happy Kids newsletter. That's on www.healthykidshappykids.com. I do plan to do more Facebook Lives. I love them, and I want to, in the new year, make this a regular event. It seems like Wednesday at 4:30, that's a great time for me. So if Wednesday at 4:30 p.m. Pacific Standard Time is a good time for you guys, let me know. Give me a thumbs up or a heart, or let me know in the comments, or if you have a huge preference for another time. But that looks like that's probably when I'll be starting them. So hopefully, and I love hearing topics from you that you would like me to talk about. And finally, if you are interested in this integrative approach, right, this holistic pediatric approach, using not just diet and lifestyle, but essential oils and acupressure points and homeopathy and herbal medicines, then be on the lookout. I'm so excited. I've been working like crazy, to bring you my online course, Everyday Holistic Pediatrics, that uses all of these natural medicines tools to give you my, holistic pediatrician recommended approaches and treatments for the most common childhood conditions like ear infections and flu and fever and cough and stomach flu and sore throats. So be on the lookout for that. And if you haven't already, I know many of you are on part of the Thriving Child private Facebook group community. And again, such a great resource. I can't tell you enough how much I learn and how much the other parents learn from being part of that group. Such a great worldwide community, truly, of parents who are supporting each other, really being with like-minded parents and practitioners who, we just all want to help our kids thrive in the best way possible and as naturally as possible, body, mind, and spirit. So thank you guys again for being here with me tonight. I am so grateful and honored that you stuck with me for the long haul. And we're listening. And again, if you caught this a little late, this will be recorded. You can listen to it all. Dana asked, what's the name of the Facebook group again? It's called the Thriving Child Community. So if you just Google or type into your Facebook search box, Thriving Child Community Facebook group, you'll see it. It'll pop right up. I do ask some questions, just to get to know, make sure, that you're like-minded and have the same goals. Anyone can join, but I like to make sure that we are all going to be a community that supports each other, right, in a very positive, loving way. So it's called the Thriving Child Community Facebook group. I hope you guys join me there. I try to get on as often as I can. Sometimes it's not as often as I would like, but again, the parents there and practitioners there are incredible resources. So again, thank you for joining me. It's been an honor to have you guys here with me. And I do plan on doing another Facebook Live next week. So stay tuned. I'll let you guys know what that is in the Healthy Kids, Happy Kids newsletter. And I look forward to, I'm going to be going through these comments and answering what I can. All right. Thanks so much, guys. Take care. I will hopefully see you very soon on another Facebook Live.